Alrighty. Good morning, everybody. Welcome to the PT on Ice Daily Show. My name is Dr. Kimo Contreras. I'm a physical therapist in Milwaukee, Wisconsin, and a TA in the fitness athlete and older adult divisions of the Institute of Clinical Excellence. It's great to be back with you here a Monday morning, second last Monday in August. Today, we are talking about EMOMs or REMOMs and AMRAPs and how to keep them simple, how to introduce them into our plan of cares, how to use them with patients, how to use them with individuals of all skill levels, all ages, and how to implement them in inpatient, outpatient, any type of practice, wherever you're at, how to use them efficiently and effectively so you're not overwhelmed with them when you first start using them. Hopefully everyone can hear me all right. First, though, obviously we want to jump into the courses here that are coming up for ICE. Finishing off the month of August, we have 4 this coming weekend. So we are busy. We're on the road. Lumbar spine management is going to be in Kingland, Georgia this weekend. Extremity management is going to be in Cheyenne, Wyoming. Cervical spine management is going to be in Victor, New York. And then fitness athlete live with Zach Long, myself, and Kelly Benfey. So an all-star lineup coming to Minneapolis, Minnesota this coming weekend, August 28th and 29th. So if you're looking for something to do this weekend, you got no plans, and you got some Con Ed money to use, definitely hit up any of these courses all over the country, right? South, west, north, northeast, a little bit everywhere. Next courses lined up are going to be the weekend of September 11th and 12th. There we have Fitness Athlete Live in Johns Creek, Georgia. We have cervical spine coming to Nebraska. I forgot to write down the city, but the state of Nebraska. Somewhere right in the center of Nebraska, I'm pretty sure. Lumbar spine management is going to be in Mesa, Arizona. And then extremity management is going to be in Bismarck, North Dakota. So lots of fun courses coming up over the next 3 to 4 weeks. Make sure you jump onto ptonice.com. Check out all our live courses. Get signed up. Check out one of these courses. Game changers for anyone looking to up their game. For all of us who are still not traveling or are just looking to do some online stuff, looking at the online courses we offer, I have a handful coming up, right? I'm just going to go with the fitness athlete and the older adult divisions here, but we have fitness athlete essential foundations. The next cohort is starting up September 13th. So about 3 weeks out from that. If you've been looking to do the essential foundations or get started with the curriculum to become certified in management and clinical management of the fitness athlete, highly, highly recommend you take essential foundations. We jump into the back squat, the deadlift, the front squat, the overhead press, the pull up, the power snatch, the power, clean. It just gets a really great foundation to understand how to use barbell movements, how to evaluate barbell movements, how to assess barbell movements, and get really comfortable working in this population and also using these implements to get individuals stronger, fitter, more active, and using them for low back pain, for shoulder pain, for knee pain, whatever it may be. So if you want to be that clinician of choice for fitness athletes, definitely start off with essential foundations if you have not taken any of the other curriculum or the live course. Either one is perfectly fine to hit up. For older adult essential foundations, next cohort is starting up October 13th. I think they are currently in a cohort right now. So a little bit longer, about a month and a half out before you can hop onto that next one. Fitness athlete advanced concepts. Next one is not till next year. So February 6th will be the next one there. But if it's something that's been on your bucket list, something you've been wanting to do, make sure you sign up. Those courses do fill up. And when they get full, we struggle to get more spots open. So if it's something you've been looking to take, something you've been looking to jump in on, advanced concepts, February 6th, get on it sooner rather than later. Modern management of the older adult, advanced concepts, your course. But if you want to be certified in management of the older adult through the Institute of Clinical Excellence, that advanced concepts course starts up October 20th. I think I read that right. So the week after Essential Foundations begins, advanced concepts of management of the older adult begins on October 20th. And last but certainly not least, can't leave the pregnant postpartum athleticism group out of there. Fitness athlete, pregnancy and postpartum. That course starts up on September 6th, also an online offering. So that's next week and a half out. Definitely check that one out if you are someone who works with pregnant and postpartum athletes in the CrossFit box, in the weightlifting arena, fitness realm, anything like that. Great course, very knowledgeable faculty, as if there was any doubt when it comes to ICE and their faculty. So check out all those courses. If you missed any of those or just couldn't understand a word I said, ptnis.com. Check out our live courses, check out our online courses. Everything is listed there for you. Okay, topic at hand. EMOMs and AMRAPs. For those who are listening who are not familiar with either of these concepts, or even like the word I just said, like they just sound like gibberish to you. EMOMs basically were created, I would say, like patented, trademarked, I don't know if he's done it yet legally, but by Mitch Babcock of the Fitness Athlete Division. EMOM in the CrossFit realm is every minute on the minute. It is basically a way to do strength training or conditioning training in which there is an interval that the work must be completed within. So for example, a lot of times I personally do it with Olympic lifts, or it'll be, you're going to do a complex of one clean, one front squat, one push jerk, something like that. And it's going to be every minute on the minute for 5 minutes, or you do every 2 minutes on the minute for 10 minutes, which equals 5 sets of that complex. When you add the R to it, it now becomes a rehab every minute on the minute, right? So rehabilitative every minute on the minute. We use the same principles of using a sort of interval, whether it be a minute, 90 seconds, 2 minutes, 2.5 minutes, 3 minutes, whatever it is. And we incorporate a strength movement, several movements, back to back to back, a cardiovascular movement to get a higher level of fitness improved and gained, along with some strength movement, along with a mobility movement. Right? There's a plethora of ways that you can make this work. And a lot of individuals, a lot of the questions we get and a lot of concerns we get, especially when people first take Ascended Foundations and they learn about the EMOMs and they learn about AMRAPs and how we can use them in the clinic, is they just don't, they're nervous. They're not sure how to incorporate them, how to start off, how to be sure things are done the correct way. And the truth is, there is no right way to do it, right? Keeping it simple is probably the easiest way. I'll start off with AMRAPs because the easiest way that we incorporate AMRAPs in the clinic, or at least I incorporate AMRAPs into the clinic, is just to ensure that the individual that I'm working with is using the correct load to be able to provide an appropriate stimulus to see some sort of strength or hypertrophy improvements, especially if my goal is to get someone stronger, to gain mass around their quad or their shoulder. Having an individual rate difficulty using RP as well, right? So I'm having someone, hey, I want you to work around a 5 or 6 out of 10. They're working there. They're saying, yeah, it's definitely a 6 or 7. And then on that final set, I incorporate the AMRAP, or as many reps as possible. What that does is help me gauge if that's an appropriate load for that individual. So if my aim is to have someone hitting a good load for 6 to 8 repetitions, but on that final set, I use an AMRAP to assess if it's appropriate, and they knock out 33 reps, I know that that individual is much stronger than they allow themselves to show or to demonstrate or to work on. So for an example, sometimes we, at our clinic that I'm 2 days a week at, they'll do a leg press, and I'm increasing weight, 10, 15 pounds each time. Like, I want to keep going until you feel like it's a 6 or 7 out of 10. I want this to be a little bit more difficult today. And they're like, okay, sounds good. They're getting after it. All of a sudden, it's their last set. I'm like, okay, I want you to do as many reps as you can do. And they're pushing, and they start talking to me, and I'm just counting on my hand, like in the background. They don't even notice. They're like, am I done yet? I'm like, you're done when you feel like you can't do any more reps. And they just stop. And it's like, yo, Margaret, you just did 27 reps. You were telling me that was really hard to do for 5 reps. So that tells me that we need to go heavier next time. That was much less of a load than we ideally want to use. That is the simplest way to use an AMRAP set to determine training loads as far as patients go, right? Sometimes it's hard to find a 1 rep max. You can't always determine that, but we need to know approximate numbers so that we're loading individuals appropriately at a load and a volume and an intensity that stimulates and promotes growth and strength and everything like that. So the AMRAP final set to determine training loads is really important. If they would have done 9 reps and I'm looking for 6, I can use that 9 rep final set to determine approximate 1 rep max, and then use that to determine some percentages for future sessions that I work with them. And it also allows me to have something to track their progress with, right? AMRAPs are fantastic. They're a great gauge for strength, and they're also a fantastic gauge for progress. If week 1 of a plan of care, someone is only able to do 5 reps at 55 pounds, but then on week 4, they're able to do 13 or 14 reps at 55 pounds, that's a fantastic sign of strength improvement, of fitness improvement, of movement tolerance, of load tolerance. So many things can be seen by using these AMRAP sets, and it's an objective number you get to look at and see. So take advantage of those AMRAP sets. Take advantage of AMRAPs in general, right? You can have something where you say, you know what? I'm going to have you do sit to stand to an 18-inch box for 30 seconds as many times as you can. I'm going to have you do that 3 times, and we're going to have a full recovery, 2 to 3 minutes in between, because I want you to work as hard as you can. I've done this with my older adults. I have an 85-year-old who I've done this every 4 weeks with. First time she did it, she did around 6 or 7 reps. Second time was around 11. I just did it to her on her discharge date last week, and she got 14, 15, and 16. She got progressively more reps each time. That's a fantastic indicator of, you know what, your fitness is improving, your strength is improving, your tolerance and ability to move your body quickly and efficiently and effectively and without pain is improved. And here are the numbers to show you exactly how much better you've gotten. Remember, 3 weeks ago, you could barely do 10 or you were struggling with 9, but now you're doing 15. So those AMRAPs in general are a fantastic way to gauge these things. Back to REMOMs, right? The REMOM is a little harder. Sometimes people get confused. They get worried, like, am I doing the right things? Am I doing too much? Am I not doing enough? That's okay. Just be flexible. Understand that you can do it in a multitude of ways. There's no one way to do it. ICE on the resources page has an entire book on, like, hey, introduction to REMOMs, examples, when to use it. I think Alex Germano did a fantastic one for older adults and for the home health setting, everything like that, about EMOMs and REMOMs and using those things. And it's really, once you get comfortable with it, just kind of play with it. I use it a lot for strength, to be honest. And instead of giving my patient 8 reps and I'm going to give you a minute rest, I literally just say, day 1, hey, we're just going to start a set every 2 minutes. I'm going to have you do this many reps. Take a seat. Let me know how difficult it felt. And we're going to keep increasing load until you feel it's kind of difficult. And then once we get there, we're going to keep you going for 3 to 4 sets at that weight, at that intensity. I have a couple patients with COPD who are older adults. They need a longer rest period. So for them, I'm probably not doing every minute on the minute because they get gassed, like, cardiovascularly. Their lungs, it's hard for them to breathe. So what do? I adjust it. I say, hey, we're going to do every 90 seconds or every 2 minutes. And I want you to focus on catching your breath between sets, but we still want to challenge your legs. And it's been great because it's allowed me to get those individuals up to like a 30-pound box squat from an 18-inch box where they're trucking it for like 6 to 8 reps. And then they just need to recover their breathing. But their strength has been improving a ton. They're able to mow their lawn for longer. He's able to golf again, right? These are cool examples where you can use it for strength. So it can be as simple as that. Pick one movement, pick a number, pick a time that you want them to work in and rest in, and then adjust as needed. If they need a little rest, just quick change it. All right, we're going to do an extra 30 seconds rest here. We're going to do 90 seconds of every minute. Or, you know what? You're killing it. This looks really easy. Go ahead and give me 2 more reps every minute because it looks a little too easy. Like you're not working too hard. Let's go ahead and push you a little bit. When we try to incorporate a lot of different other things, right? When we try to do alternating EMOMs or alternating movements every minute on the minute, that's when sometimes people are like, I don't know what exactly to do. So again, keep it simple. The things you're already doing with your patients. If you have a patient who you're working on, for example, they have a little plantar fasciitis or something, you want to work on some of that ankle mobility, that foot strength, the calf strength, everything like that. If you're already doing like a banded ankle mobilization to kind of loosen up that joint, if you're already doing a calf stretch of some sort, and if you're already doing some sort of loading, which ideally everyone should be loading their patients, especially Achilles tendinopathy, plantar fasciitis, rhabdomyopathy, you want to be loading those individuals. So take the things you're already doing with your patients, make it more engaging, make it more exciting, make it a little more challenging by turning all those things into an EMOM. Minute 1, hey, I want you to do this banded ankle dorsiflexion mobilization. Just really kind of let the band pull back on you, or you can get on there with your hand. Hey, 30 seconds, I'm going to do some manual ankle dorsiflexion. Or tailor glides, right? Minute 2, I want you to do this eccentric ankle dorsiflexion where we're kind of slowly loading and lengthening that calf muscle a little bit just to open it up a little bit, get a little bit of a stretch, but use the load in your hand and your body weight to open up that gastrosoleus complex and just give a little bit of mobility. Minute 3, I want you to do this goblet squat. I want you to sit and I want you to intentionally think about letting your ankle drive forward and let the weight kind of push you down a little bit more. So now we're kind of utilizing all that range of motion you just gained from the banded mobilization and the soft tissue mobilization. Right? Simple. Every minute in a minute for 9 minutes. You're doing 3 rounds of that. Right there. That's 1 TheraX unit. Mobilization with movement. You don't have to have your hand on there, right? That's a really easy one to do. So take the things you're already doing with patients and kind of use them. Another example I have right here, if you're working with someone with stiffness in their shoulder, you want to get them overhead a little bit more. And this is probably going to be a little bit more in the CrossFit population or fitness athlete population. But maybe you're using an eccentric PVC shoulder flexion, right? You're using the PVC with a plate on it or a kettlebell and everything. They're using that to slowly open up and lengthen the lat and the shoulder complex. That's minute 1. Minute 2, they're doing prone PVC lift off. They get on there. They try and access that range of motion by lifting that PVC pipe off of the ground and really activating and getting up off the ground. And then minute 3, they're doing a press. They've opened up their shoulders, trying to get more range of motion. Now I want you to press, pause at the top, and really work on getting that elbow by your ear and pressing overhead in that full range of motion you now have. Minute 1, minute 2, minute 3, every minute on the minute, 9 minutes. There's another direct unit, right? And lastly, a nice easy one again. If you want to incorporate multimodal things, right? The last 2 I did were basically mobility, and then some sort of loading or strengthening. You can do anything you want. And for example, let's say you have an individual who wants to go back to sport, who in general needs to have their fitness level a little bit higher. So it could be a CrossFitter. It could be anybody working in work comp, right? Fitness is really important for a lot of individuals who have heavy manual jobs. So can we incorporate some sort of cardiovascular fitness as well? Can we get somebody on a bike, if you have an Airdyne bike or an assault bike in your clinic? Can you get someone on even just like a upright bike and just get that intensity of, hey, 30 seconds, I want you to pedal fast, get that heart rate elevated quite a bit. From there, we're going to go to the wall. I'm going to have you do a wall sit, right? We pre-fatigued your quads and your legs. Go ahead and do a 30-second wall sit. Really just gas out those quads. And then we're going to finish up with some cyclist squats or some lunges or some step-ups. Or I want you to hold this like 20-pound medicine ball at your chest and go up and down this 12-inch box over and over again for 60 seconds. Then I'm going to have you rest a full minute in between, right? We're incorporating things that they might do with their job, with their demands of their task or whatever they have to do, but we're pre-fatiguing their system. So rather than having to have them be there for 8.5, 9 hours to kind of mimic it, what if we get that amount of work done in 40 minutes and get them an idea of, okay, this is what your cardiovascular fitness is like. This is what it's like when you're fatigued. This is how you would benefit from getting stronger and more fit in order to allow you to do the things you need to do at work without an issue. Cool. Could go on for a while, but again, keep it simple. I just want to kind of leave it there before I kind of go off into some more tangents or anything like that. Keep it simple with EMOMs. Keep it simple with AMRAPs. Don't overthink it. If it's not working, just be flexible and modify. If it's too difficult, reduce reps, increase time. Just be okay with a little bit of flexibility. You're probably not going to nail it the first time correctly, or maybe it's going to be too easy the first time. You're like, okay, next time they come in, I need to make note of that so I can make it a little bit more difficult for this individual. But be okay with kind of getting a feel for it, kind of trying some different things, and then be like doing some different things as you get more comfortable with it. Hopefully that helps. Hopefully that if anyone is still struggling with the ideas of EMOMs or AMRAPs or how to use them in a clinic, how to incorporate them, don't forget to dose them out from home exercise program, right? People love it. If you can just teach them how to use their phone as a stopwatch if they need to, and say, hey, when it says 1, you do this. When it says 2, you do this. When it says 3, you do this, and you just keep going that way. Give it for their home exercise program. They can be more exciting, more engaging. They know that when they do their home exercise program, it's going to be 12 minutes and that's it, because it's 4 rounds of every minute on the minute for 4 minutes, or for 12 minutes, I'm sorry. And they can get it done in 12 minutes versus I want you to do 3 sets of 10 and then rest each time, and then another 3 sets of 10 and then rest. And then all of a sudden they're like, oh crap, I have like 30 minutes worth of stuff. Like this is not fun, exciting. I'll do it. But like, I mean, I wish it was more engaging. So remember to kind of dose it out for home programs too. People enjoy that. They really enjoy that stuff. Awesome. A little bit over my time here. I don't want to keep anyone. Have a wonderful morning, everybody. Have a great, great week. Thank you for tuning in this morning, and we'll catch you next time on the PT on Ice Daily Show.
Hey, thanks for tuning in to the PT on Ice Daily Show. If you enjoyed this content, head on over to iTunes and leave us a review. And be sure to check us out on Facebook and Instagram at the Institute of Clinical Excellence. If you're interested in getting plugged into more ICE content on a weekly basis while earning CEUs from home, check out our virtual ICE online mentorship program at ptonice.com. While you're there, sign up for our Hump Day Hustling newsletter for a free email every Wednesday morning with our top 5 research articles and social media posts that we think are worth reading. Head over to ptonice.com and scroll to the bottom of the page to sign up.